Hey, Natasha. Hey, Natasha, how are you?
I'm all right, thank you. How are you?
I'm fine. We're just going to wait a little bit for people to join in, then we can start, I think, at 20:05 or 20:10, somewhere there.
Okay, okay, sure.
All right. Welcome, Brian. We are just waiting for more participants to join in before I start today's lesson.
Thank you so much. Thank you.
Yeah, and in case you notice anything different, we are having the sessions recorded so that for those who don't make it to the session, they can still be able to catch up by watching them from our YouTube channel.
Hello, I didn't get you. Sorry. What did you
I'm
say?
saying I'm saying if you notice anything, because I know when you enter, it's like recording in progress. I'm saying we are recording the
Oh, yeah,
sessions.
yeah, yeah.
Yeah, we
Okay,
are
yeah.
recording the sessions so that for those who are still interested to catch up, if they miss the class, they can be able to access them from our YouTube channel.
Oh, that's great.
Yeah, although they will be uploaded a little bit later, but then the notes will immediately be shared after each class.
Okay, but I can't see your name is not appearing here. I can only see Mr. Ngosa, Natasha Yombwe.
Yeah, because I'm using the I'm using the
Oh,
organization.
you're using his account.
Yeah, like
Oh, okay. No,
the
I get it. I
organization
get it.
did the used the paid version of Zoom and is the one who made the payment. So that's why you can see Ngosa instead
No,
of
I
me.
actually understand. I'm sorry. I just forgot. I
Oh yeah.
normally see your name showing, so I was just
I
okay.
wonder if it's Ngosa facilitating.
Yeah,
Oh,
yeah.
I think at 2010 we can start for
At
those that
20.
are at 2010 we can start because I know you guys also have other important things. For those who just be admitting them as they come.
Okay, okay, no problem. Hey, how you there?
Yeah, I'm still here. I'm just encouraging people to join in. I'll start the lecture at 2010. So that's when I'll start speaking.
Yeah, it looks like we have a lot of Seventh Day Adventists, yeah, who are not good at timekeeping. we
I
have
know.
less, we have less Jehovah's Witnesses here.
I know. Don't worry.
We need a Jehovah's Witness, but all right, please encourage them.
No, I've actually given them like it's 2 minutes. So for those who still, because it becomes disturbing when you are lecturing and then somebody is still trying to join in the Zoom. So now
Very
it means
much.
that you stop, then admit the person.
Mhm.
Yeah,
Very
and then
much.
when you also feel the need to actually go back so that the person catches up.
Okay.
Yeah.
Mhm.
Okay, so we have 1 minute. So let me just start sharing my screen now. Are you able to see the screen, the sharing, the
Yes,
slide? All right,
yes, we're
perfect.
able to see.
So today we are on lecture 2, which is basically talking about menstrual health hygiene getting started. So we did menstrual health hygiene basics in lecture 1, where we talked about the norms. We talked about the norms, the myths, and other things that we talked about here. Now, in menstrual health hygiene getting started, we'll focus on what we should be doing at household, community, sub-nation, national, and international levels in relation to menstrual health hygiene. What role would the household be playing, the community, the sub-nation, the national and international levels in relation to menstrual health hygiene? We'll also look at institutional and sector responsibilities, like what does the Ministry of Education do as an institution or as a sector? What does it do, or what should it do in relation to menstrual health hygiene? Or let's look at the education sector. How can it contribute towards menstrual health hygiene? And then we'll move on to talk about building confidence and competence, where we'll look at how can you as an educator, because we are educating menstrual health hygiene management, how can you advocate for menstrual health hygiene at your workplace? How do you get your staff or members or colleagues to get interested in menstrual health hygiene management? And then we'll move on to talk about men and boys' involvement in menstrual health hygiene. And then we'll look at resourcing for menstrual health hygiene. Now you're an educator. How do you fund, or how do you come up with campaigns? And what do you need to consider when you're setting up an outreach? What do you need to put in mind, and who do you need to involve when you're setting up an activity? So basically, this is what menstrual health hygiene getting started will focus on. So let's look at what should we be doing at household, community, sub-national. We'll start on the household level. Let's look at the men's and boys. What role can they play? So men's and boys can come in to help us by challenging negative attitudes and perceptions. There are so many negative information about menstrual health hygiene. They can speak about taboos that are put in place to restrict people from talking about menstrual health hygiene. Negative attitudes that discourage people from talking or advocating about menstrual health hygiene. Uh, in the African setup. And then another thing they can do is by sharing information on good menstrual health hygiene practices. Even men and boys can be educated on good menstrual health hygiene practices. And that information they can use to share to their sisters, to their peers, to their colleagues. Yeah, even to their own wives. And also by participating in local production of menstrual products. Men can also come on board in helping us make sanitary pads. Yeah, so they can participate. They can even facilitate classes where they train young people on how to make reusable pads. Ensuring women and girls can afford sanitary pads. That's how they can help. That's the role they can play. They can ensure that they can ensure that girls and women can be able to afford sanitary materials. and also addressing barriers to water and sanitation for the hygienic management of menstruation with privacy and dignity. One thing we know that when it comes to managing menstruation, one key thing that is needed is water and also privacy. For period to be carried out in a dignified way or in a respectable way, there is need for privacy, and also there is need for access to water, and also to have access to places where they can properly dispose of used sanitary pads, so they can help us by addressing those barriers. They can advocate for bathrooms or toilets that also have included showers in them, so that it can be able to cater for the needs of a girl child or a woman during that time of the month. So that's the role that men and boys can play at an household level. And then let's talk about women and girls. How can they come in at an household level? By managing their own menstruation hygienically to maintain their health and those of others. They need to be, so managing menstruation is not just about about maintaining their own health, but it also helps maintain that of others. If you keep throwing used pads everywhere, that's very unhygienic. As them being able to manage it in a proper way will also help maintain the health of others that they are with. This can also include making, drying, and disposing of sanitary pads, sanitary materials safely. Like I've said, you can't just be throwing them anyhow. And also another thing that women and girls can do at an household level at home is that they can be supporting other women and girls with information on good menstrual health hygiene practices, especially for preparing young pre-adolescent girls for menstruation, especially those girls that are yet to start seeing their period. So they can be helping them by supporting them, by giving them information beforehand and how to go about in a case that a girl child experiences a first menstrual health, a first menstruation. Even if no one is present, she'll be able to carry out or conduct herself in a way that she doesn't end up being ashamed or embarrassed. Yeah, so that's how they can help. They can help by supporting other women. They can give information on good menstrual products that are available, or how to actually make their own reusable pads. That's how women can also help other women. And also by addressing barriers to water and sanitation for the hygienic management of menstruation with privacy and dignity. They can also help by challenging negative attitudes and perceptions. How so? By speaking about menstrual health hygiene. I know in our culture it is considered as a taboo, but let's normalize talks about menstrual health hygiene and how one can manage a menstruation like in an hygienic way. So if we can normalize such talks as women at an household level, if we can tell our young sisters, our cousins. Let me just admit one person. I'm going to disconnect a little bit because someone is waiting in the waiting room. Okay, so I think Jessie has left. Okay. Let me go back again to the screen. That's what I was trying to avoid. If people come in between, means I have to go back and forth. Okay, just let me know if you can see. Hello?
Yes, we can see.
Yeah, we can
I
still
can
see.
see. I don't know how Natasha, but I can see.
I can see. Yeah, I can still see as well.
Oh, all right, perfect. So now we are moving on to the community. What role can they help? Can they do? By breaking the silence, confronting dangerous myths, taboos, and practices, and challenging negative perceptions. So that's the role that the community can play in managing menstrual health hygiene. and also by sharing information on good menstrual health hygiene practices, and also ensuring adequate and sustainable access to community water and sanitation facilities. So when you look at it, you actually realize that menstrual health hygiene is not just something that is left up to an individual. It also affects the community. And hence the community also has an important role to play by actually breaking the silence, talking about myths and taboos that are there that negatively affect women when it comes to menstrual health hygiene management, and also by ensuring equipment and sustainable access to community water and sanitation. And also another thing that the community can do is involving women and girls in decision making about water and these sanitation facilities. Because at the end of it, or this is something that affects women. And hence, when we are advocating or talking about this, we must also include women and girls in the decision making so that we can best capture their best interest and not make it about us as the community, but then we remove people that are mostly affected by this. Now let's talk about we are still also a continuation on the community by also ensuring schools support girls and female teachers to manage menstruation hygienically with private and secure latrines and methods or facilities for safe disposal of sanitary products. So that's another thing that they can do. The community can ensure that schools support girls and female teachers by putting up secure latrines or places where they can dispose of their sanitary pads. Okay, let me admit one person. And then another thing that the community can do is ensuring girls and women in vulnerable situations are able to manage menstruation hygienically and with privacy and dignity. When we talk of women in vulnerable situations, we're talking about women that are found on the streets, women that are disabled. The community can help by enabling them to manage menstruation hygienically and with privacy and dignity. And also the community can play a role in encouraging the establishment of local small businesses that can make sanitary products or ensuring shopkeepers sell affordable and accessible alternatives. We can even encourage a local tailor to make, the community can even encourage a person who's maybe a youth who specializes in making usable pads. We can support the small business, let's say by purchasing from them as a way of encouraging so that they can be able to make more reusable sanitary pads. That's the role that the community can play when it comes to menstrual health hygiene management. Now let's look at the district, regional, and then also at the national level. What can they play? What role can they play in advocating or managing menstrual health hygiene? By developing local registration policies and strategies supporting good menstrual hygiene practices in the workplace, public places, schools, the home, and the community. And it's so amazing that today there's actually a newspaper, I think I shared it in the group, where they're saying the state will now be providing free sanitary pads to school-going children, which is amazing. And which basically relates to today's topic, the role that the government can also play when it comes to ending period poverty. And they can also come in by supporting education and awareness raising, training teachers and other professions and community leaders in good menstrual health hygiene practices. And another thing is allocating resources for programs related to improving menstrual hygiene practices and facilities. Now, what should we be doing at household? And we are still looking at it. Now let's go at the international level. The international level can come in by undertaking advocacy on menstrual health hygiene and dissemination of good practices. At an international level, you find that there are a lot of women and men from different countries that are advocating for menstrual health hygiene. And another law they can play is by funding programs to increase knowledge of good menstrual hygiene management practices, and also developing policies that mainstream good menstrual health hygiene practices. So at international, we find advocacy, funding, and developing policies that are there to promote menstrual health hygiene practices, and also breaking the silence, confronting dangerous myths, taboos, and practices, and challenging negative perceptions. And in on Monday's lesson, we talked a little bit more about taboos and myths that are there. Now let's look at the institution and the sector responsibilities. The health. How is it linked to menstrual health hygiene? You find that menstruation is a biological process of the female reproductive system. But again, you find that they may be health risks associated with poor menstrual hygiene. That's where now the Ministry of Health or the Department of Health comes in. Because in as much as it's a biological process, you find that there are also risks that are associated with poor menstrual health hygiene. Now, what are their key responsibilities? They can provide accurate and user-friendly information on their biological facts about menstruation, menstrual health, and hygiene. That's what they can do. They can provide accurate and user information. Now let's go on to education. How is it linked to menstrual health hygiene? You find that if girls and female teachers are unable to manage their menstruation at school, girls will miss classes when they have their periods and may drop out completely. And if a girl child misses classes consistently, you find that their performance can suffer. They cannot be performing as expected because they are always trying to catch up. And another thing is that the performance of a child can suffer due to stress and discomfort. Because in last lecture, we talked about the fact that how menstruation also brings about shame, stress, and stress and depression. It can even lead to depression for someone who has not well understood it. Yeah. So now, what are the responsibilities? They can ensure that adequate water, sanitation, and menstrual health hygiene facilities are in school. They can also sensitize teachers and students, that is including boys, about menstruation and menstrual health hygiene, and promote a supportive environment. And it's amazing even when we incorporate boys as well as male teachers in when we are sensitizing them about menstruation, because it's now enables, let's say, a teacher who is unaware, just a male teacher who is unaware, finds a young girl constantly wanting to get outside, like go outside. If they are unaware about menstruation, they might think maybe this one is just troublesome and stuff, but not knowing that the child maybe needs to take care of herself or go clean up herself constantly. Because during menstruation, you find that women have different flows for the blood. You find that some days it might be heavy and it might require you to do most of the heavy lifting. But then if a male teacher is educated, it's easy to show support or allow a child to actually. Okay, let me admit one person. I'm so sorry, guys, that I keep. I'll soon connect. There's someone asking for a link. Okay, I think I'm done. Okay, so we have talked about the health, the education sector. I don't know. Can you just mute yourself? when you join in. Just kindly mute yourself. Okay, then we have the community development. How is it linked to menstrual health hygiene? The community. The community development actors have a linkage at the local level access sector that can support menstrual health hygiene. Also, the community development programs may provide support to small enterprise for producing and distributing low-cost sanitary protection materials. That's the role they can do. They can support small enterprises or small businesses that are producing and distributing sanitary pads to actually be able to do that at a low cost, so that now women and girls in the community can be able to afford the sanitary pads. And then let's look at the responsibility. They can support community, it's the same thing. Basically, they can support businesses to produce or supply sanitary protections at a low cost. And then they can also provide menstrual health hygiene information to community organizations. That's what the community development can come into play or assist. So let me admit one person. Okay. Okay. Can you still see the screen? Hello?
Yes, yes, we can still see it.
Okay, perfect. So now we are moving on to building confidence and competence. This one basically focuses on you as an educator. How can you get your colleagues, your boss, or your friend to get involved in advocating for menstrual health hygiene? So we are looking at opportunities to encourage learning and talking about menstrual hygiene. Mainstream menstrual hygiene into your organization policies, strategies, and guidelines and procedures. But then how do you reach a state where you actually convince your boss to involve menstrual health hygiene into your organization policies, structures, and guidelines and procedures? Firstly, you need to at least know the basics about menstrual health hygiene, and also find a way that can make you the person you're trying to get involved also have interest. That is how you can make menstrual health hygiene part of your organization policies. And you can also elaborate to the people on the importance of actually incorporating menstrual health hygiene into the organization policies, strategies, and guidelines, as well as procedures. And also you can develop specific trainings, discussions, or awareness raising sessions with your colleagues. You can do it with your boss, where you develop trainings that are specific on just the discussion or raising awareness about menstrual health hygiene. And you can also encourage the staff to look and compare a range of menstrual hygiene materials, so as also to encourage more discussions on menstrual health hygiene. That's how we can build on confidence and competence, not just at the community level as well as from our workplaces. Now let's move on to men and boys' involvement in menstrual hygiene. What are some of the reasons to get men and boys involved in menstrual health hygiene? How do we get them involved? Men and boys have an important role to play in supporting women and girls in their menstrual health hygiene. As fathers, brothers, uncles, peers, and even colleagues. And this may be, how can they do so? This may be to provide support at home or school when a girl faces a first period, or a woman has an embarrassing or difficult experience. They can be able to provide support. It could be to a girlfriend. Maybe they are walking around and somebody stains themselves, or to a young girl who is first experiencing their first period. That is how they can do. They can provide support. And also as the head of the household who controls the finances, to ensure female family members can afford appropriate sanitary protection materials. That's why we need them to get involved, as they are the ones that controls finances, but if they are aware, then it will be easy for them to offer financial support that will in turn enable women to actually afford appropriate sanitary protection materials. And another reason is that as a community member who can challenge taboos, social norms, and stigma, and influence the attitudes of others, that is both men and female. That's how men and boys, that's why men and boys need to be involved in menstrual health hygiene. And also as teachers, employers, ensuring that school or work environment makes it easy for girls and women to manage menstruation with dignity. And also as a professional engineer, social development specialist, manager, or medical personnel, supporting programs for improving the menstrual health hygiene context for girls and women. So that's why they need also to come in and get involved in menstrual health hygiene. Another thing is that it is important for boys and men to respect girls and women. So basically educating boys, particularly from adolescence, on the challenges and struggles girls face would help reduce teasing and help them become more understanding and supportive husbands and fathers. Sorry, I'm just closing the door. So I have left some questions. I don't know if we can unmute ourselves to attempt these questions. That is, do you know of any male menstrual health hygiene champion, or have you come across any man that advocates for menstrual health hygiene? And for the men, could you become a male menstrual health hygiene champion? So you can just basically unmute yourself and get to discuss. Have you ever come across a man that advocates for menstrual health hygiene? Hello, guys. Or should I start now calling out names? Brian,
Okay.
could you become a male menstrual health hygiene champion or Ngosa? Because we have men here.
I think Mr. Ngosa can come in and then I'll come later.
All
No,
right,
please go
perfect.
ahead. Go ahead, Brian. Champion.
Okay. Yeah, Judith, yes, I'm already that. So
Mhm.
yes, yeah, the answer is yes. And about the first question, I think I know about Mr. Ngosa. The second question, I am. For the first question, I know about Mr. Ngosa.
Oh, okay.
So those are my two answers to the questions that you posed. Thank you.
All right, Ngosa.
I hope I haven't provoked him.
I think you have. Okay, if you speak of like people who like champion these things, I might not know like so many people. Again, I think that's something that we can do better as men. But there's like Facebook personalities like Dr. Aaron Mujajati. Sometimes he speaks about these things, and I think that's a great platform. Would I become one? Mental hygiene champion. I think champion is a big word, but I have learned that you can support women, for example, in the financial way as well. You know, just make sure that you can provide for them if they need. And I think that is something that I would implement in my family or amongst people that are depending on me. So yeah, I think I would become one in some way.
Okay, thank you very much for those wonderful contributions. Natasha, do you know of any man?
I wouldn't specifically say that I know of any man, but I have seen men post, menstruation is not by choice, sex is by choice. So make pads free and condoms for sale, stuff like that. I've seen quite a number of men post, but I still do feel like they still don't have the adequate information on menstrual health, because it could be that you just copy and paste what somebody else said because they got a lot of engagement on that post. But yeah, I have seen so there are actually even some men that have I think there's some people that do like pad drive. I think if not on the Copper Bells in Lusaka. So basically they just collect pads from different people and then donate to different schools. And there's men that are involved in that as well. So yeah.
Oh yeah, yeah. I don't know, Betha, do you know one? I'm now calling out people's names. I'm sorry. Betha, I don't know if you're still with us.
Yes, yes, I'm still with you. Just that network was kicking me out. Yeah, I do know of such men who usually like they contribute, they buy pads, then they take them to school just to help those children who are not able to access having pads. Yeah, so there are those people who are in that, but yeah, but there are few.
Oh yeah, that's so true. Okay, so at least we do have, but then at the end of the lecture, I'll be able to share some from different parts of the world. And then we also featured one from Kenya. It's called the Padman. He basically contributes, donates, like you have said, he donates pads to different schools. And then I know of one from the Copper Belt, he also donates pads to like different schools. But then you see that there is still, like Natasha said, there is still need for people to be educated to actually have the relevant information and not just be there pasting. Yeah, and then like Ngosa said, you'll be there supporting, giving the financial muscle so that people can be able to support, his family can be able to be able to afford appropriate sanitary protection, which is amazing. So now moving on to 2.5, I think this is basically the last part for today's session, which is a resourcing for menstrual hygiene, budgeting for menstrual hygiene. So what is budgeted for will depend on the focus of the program. Now this comes down to you as an educator. You want to put out an outreach program. You want to put out an outreach program, but then for that outreach program, you need specific things to be present there. So now that is where they're saying what you budget for depend on the focus of the program. Maybe let's say your focus is I want to facilitate a session on how to make reusable pads. I want to do it at Namwandwe Secondary School. Yes. But so I should be careful not to overlook the elements that will be essential to ensure the quality of the program and engage women and girls in the program design and feedback. And then gender budgeting. So before I go on to put that into practice, let me just read this. Gender budgeting means showing awareness that some problems are more relevant or particular to boys or women, and some to boys and men, and some to girls and women. This includes budgeting relating to improving the menstrual hygiene situation for women and girls. You know, there are some times where we stand in to say, okay, if they are talking about menstrual health hygiene, then why are they not putting out programs for boys? But then when that's where now gender budgeting comes in, there are certain programs that basically focus on a particular gender, but it doesn't mean the other one is not much important. But then you have picked out that particular gender because that's the program that you want to focus on. It's menstrual health hygiene. And who do you consider mostly when you're budgeting for this? It's women and girls. So factors you need to consider. This is me, Judith, a menstrual health educator. I want to do an outreach at Namwandwe Secondary School. So let's look at the program. What do I need? I need to raise awareness sessions for women and girls or community or religious leaders. That's what I want. But then I want to focus on school-going children at Namwandwe Secondary School. I need to purchasing for the printing and distribution of menstrual health hygiene books. So I need books. Let's say on my program outreach, I want to have access to books. So I'll put the price down for the books that I need and the number of books I want to purchase when I'm planning for the outreach. And then also look for funds for the improving of water, sanitation, hygiene situation in the schools. Or maybe I don't want, maybe I in as much as I want to distribute printed materials, I want maybe at the end of the session to also go to the mayor or the councillor that particular area and also talk about the funding for the need for proper latrines at the school that I've observed after the training has been done. And also, basically, these are just some of the things you need to put in mind when you're planning for your training that you basically submit to us at the end of the training. At the end of this training, you will put out to us how you want to conduct your outreach. So you might also think about establishing sanitary pad production workshops. What do you need? Okay, if I need to establish a sanitary pad production workshop, I will need some machines, and I will also need to employ, let's say, women that can be able to make usable sanitary pads. So I will need a sewing machine. How many sewing machines do I need? And how many women do I need to employ? So these are things that you need to put in consideration when you are putting up or you are planning a program for the outreach. And then another thing is set up and training course for women or girls or groups making local sanitary products or soap. Let's say you move away from establishing that, but you just want to focus on training women how to make sanitary products as well as the soap. You might want to put in mind the transport, the materials that will be needed. You might need to buy some thread, some needles, some scissors, and some fabric. So you put all those things and you plan for that. And also, another thing you might want to do is to supply sanitary materials for women and girls in emergencies. Maybe you don't want to go to a school. You'd want to make donations to an hospital or a clinic. And then another thing is advocacy for activities for awareness raising. Maybe you want to just advocate. Or how do you want to advocate? You might consider which media am I going to use? Am I going to use Facebook? You might need data bundles. Or am I going to a radio station to actually advocate and raise awareness on menstrual health hygiene? So these are some of the things you'll be considering. And another thing would be supporting government with policy development on improving menstrual hygiene. How do you support that? You might come up with a draft on menstrual health hygiene policies and then approach a government worker and get to discuss. So basically, these are some of the things you'll be considering as you are resourcing and budgeting for an outreach. So that's the end of lecture 2. Do we have any questions? Any questions, guys? Hello?
Hello.
Yeah, do we have any questions? You can ask me any questions. This completes lecture 2.
I think for me it's a contribution and like a question.
Oh, all right, perfect.
Okay, but I think I'll allow if there are any questions so that they come in, I leave room so that you tackle the questions and then I can contribute later.
Okay. Do we have
Is
any
that okay with
questions?
you?
No, it's fine.
Yeah.
It's fine. Do we have
Okay.
any questions from the audience?
Yeah, I have a question.
Yes.
Yeah, so usually amongst guys or men, it isn't very common for them to talk about things like this. And there's sort of like a taboo connotation that is attached to speaking about menstrual health, especially amongst guys. So how can you deal with that mentality, and how can you should it continue being like a taboo to talk about these things with our culture and all of that? So I'd just like to know maybe what's your take on these issues.
Which is amazing. I think if you had like joined earlier, you find that when we were looking at households, and the role that men and boys can play. We talked about the fact that they can help by raising awareness on negative attitudes, taboos, by actually speaking against that. So what will really help is men coming in and actively speaking or advocating and normalizing the talks surrounding menstrual health hygiene, because you find that menstrual health hygiene talks is also considered a taboo among women. So it's hard for even elder women to educate young girls on menstrual health hygiene. And this is what we are trying to break, the barrier that we are trying to break, where we normalize such talks. So what would really help is actually even men coming on board to help us as we are trying to break these barriers. I don't know if I have answered the question.
Yeah, it's very clear.
All right, thank you. So is there any other question? Okay, if there are no questions, I think Brian, you can contribute that. But don't worry, ladies. Lecture 3 will be about us contributing, and these guys won't say anything.
When you say we will not have anything to say, I think I'm not cool with that.
Yeah, because you won't know anything, but then if you join in area, you might actually understand some things.
Natasha has been saying something, and so Ngosa as well. So don't intimidate the man. we'll still contribute even in the next lecture.
Perfect. I'll be waiting.
Nevertheless, my contribution is that I think I would want to talk about the part where you talked about the home setup. I think in the household setup, it goes beyond the father removing the money for the pads. We also need to work on the mind. We men need to have a positive mind about this. It's not just about, it's different when somebody gives you money, go and get pads, okay? If they do not understand why they are doing that, you may misinterpret what they're doing, okay? So there is need for us to actually ensure that men start developing that positive mind, a firm mind about this. When we actually create that, it's going to be easy, even for men, fathers, uncles, and wherever, sitting these girls down, telling them this is this is that. So basically, we're looking forward to a situation where people or parents or the fathers, the men, will not just remove money, but will also sit these people down and talk about these issues. So that is the contribution I wanted to make about what you said. It's actually beyond, um, giving the support financially, but we need also to involve the men in terms of the mind. When you work on the mind, it's very important, because even what comes ahead is going to be easy because you've already worked on the mind. The mind is fully acquainted with what's on the ground. Thank you so much.
Yeah, thank you for that wonderful contribution, which brings me back to Innocent, his concern that you raised in Monday's lecture, where he talked about the fact that have we ever considered maybe a girl child that is being raised by a single father? And then this is something that we consider as a taboo. So how does that single father come into help? Which is wonderful that you have talked about the changing of the mind. So I don't know if there are still more questions or contributions. You can just unmute yourself and then you can contribute. And question, don't make me start picking people. In fact, okay, yes, Natasha, please just unmute yourself.
Okay, I just want to concur with what Brian has said, and basically what you've just also like made a conclusion on. It's very important for the mindset change, and I'm very glad that you brought in the scenario where somebody is a single father, you know, and this is a father to girls. And of course, at some point they are going to reach an age where they are going to start menstruating and all of that. And so it starts with all of us as a whole, men included, boys included as well, in educating about menstrual health, so that if boys are educated from the get-go, that's information that they are going to carry with them for the rest of their lives. They will know how to deal with their own daughters in a case where they get to have daughters in the future. And we're actually going to do away with the situation that has been there in the past, where when even some of us, even our mothers, couldn't speak to us, about menstrual health. They had to call an auntie, and this is an auntie that you're not even used to. You've never even said more than 5 words to, and this is a person that comes to sit down with you and starts teaching you. They're not going to teach you, things directly. They'll teach you things indirectly. They'll tell you, okay, so now at this stage, don't play with boys. And then you get shocked. You mean, but what do you mean don't play with boys? So which means they're not going direct to the point about, oh, this is now you are at an age where you're menstruating, and you're menstruating, this is how you're supposed to take care of yourself, ABCD, and all of that. So there's this huge cloud of shame, huge cloud of taboo that surrounds menstruation. And with trainings and programs like this, it's a good thing, because that is going to help us now, uncover that huge cloud of shame and taboo that has been bundled around menstruation. That's all.
Okay, thank you so much for that wonderful contribution, Natasha. And that is very true, for the fact that our parents are not even being honest. They just say, don't play with boys. Like, let's have honest chats and tell someone why they should not specifically, and what they should not specifically do, so as to avoid troubles. Let's not speak using tricks or kind of fancy words, but then at the end of it, or a child is left without proper information. And then when a child is left without proper information, they will access it elsewhere. And when they access it elsewhere, you can never know, when a person is accessing it elsewhere, how accurate or relevant that information is. So there's definitely need for such. I don't know is there any contribution from the group? Christabel, I've not heard you speak. Say something.
Yeah, I'm sorry, I've been observant. Yeah, so the world is changing. So this goes for us as well to go along and change with how things are moving. Because I can attest to the fact that my dad has been that person who's been supportive. Though long ago I would be very afraid and scared to approach him on such issues, but he would step up and talk to me and teach me on things that I do not know, even when like I was new to the same thing. So he was always there. And I would also encourage for men to step up as well, to also learn these things, so that they'll know how best to help out girls, because it's very much important. Let's like this thing of having that mentality that no, guys can't do this, like, end, because everyone needs to do it. It's a one thing, guys, women, everyone. Yeah.
All right, thank you so much for that wonderful contribution. So, men, you've been challenged, and us as ladies, you have also been challenged to share the information. So, thank you very much. This was a very interactive class. I'll see you next week, Monday. Bye.